Namaskar, good morning, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals every Sunday. In this live session, you can ask all your questions and queries. We shall bring out an answer from the expert who's going to join us very soon. If you want to ask a question, today we're going to talk about monsoon diseases and how to survive them. If you have a question or a query, please do come onto the YouTube chat. You must be watching this on Instagram and Facebook and YouTube as well. Your questions will be answered from YouTube chat. So please do hop on, do like, subscribe, share our YouTube channel as well, and do follow us on our socials. You do get a lot of information when you follow Apollo 24/7. So Apollo 24/7 app download कीजिए. On the show, we also have a health quiz coming up, and also we share discount vouchers towards the end of the show. Today, we are going to talk about Monsoon Survival Guide, how to shield yourself from infectious diseases. And today, we are going to have an expert who's going to talk on this and give you some information and important tips to deal with. So today, we have Dr Mithun Bhartia, who's an endocrinologist from Apollo Hospitals, Guwahati. Guwahati से सर ज्वाइन करेंगे हमें. इनका एक्सपीरियंस है 12 साल प्लस का एंड प्रोफेशनल मेंबरशिप्स है एमआरसी पे यूके, एमआरसी जीपी यूके एंड एम्स्टरडैम से सर ने सीएसएम की कर चुके हैं. नेशनल टेक्नोलॉजी टास्क फोर्स मेंबर आरएसएसडीआई, एनसीसीटी एंडोक्रिनोलॉजी यूके से कर चुके हैं. ही इज अ नेशनल सेक्रेटरी फॉर एसोसिएशन ऑफ क्लिनिकल एंडोक्रिनोलॉजिस्ट and co-founder of DTech, which spearheads the latest technological advancements in diabetes in India. He can be consulted for diabetes, thyroid, and other problems as well, sexual health as well. So here's Dr. Mithun Bhartia on the show, live with us today. Good morning, sir. Welcome back.
Good morning, Jhansi, and I welcome everybody to Apollo 24/7. And I hope with the monsoon trickling, everybody is having with a cup of tea today.
Yes, doctor. Garam chai ke saath thode garam tips bhi ho jaye. So we appreciate your time because we know that today was a very busy day and packed day for you, and you joined us last minute. Today our expert Dr. Suresh, due to his personal reasons, could not join us, and we acknowledge your gracious presence here. Thank you so much for doing this for us.
My pleasure. Thank you.
Yeah, I know that it's been a very busy week for you. And you have traveled from south to north to northeast. How is the monsoon treating you all there?
So I think the monsoon has moved everywhere. ऐसा नहीं कि कहीं monsoon की कमी मिली. Hyderabad was full on monsoon. Guwahati is also full on monsoon, and I'm sure rest of the parts there is monsoon because वो जो भीनी खुशबू आती है ना जब वो बारिश जमीन पे गिरती है, that मीठी smell with the mud. That daily actually, everybody remembers their childhood days. अभी तो सारी बिल्डिंगें आ गई, but when it was all.
Doctor. Yeah. So वो strepto. So उसको कुछ बोलते हैं that.
I was also that thing. There's that smell. People who know that smell.
Absolutely. So with that smell, with those lovely lingering memories of childhood, also come the scare of infectious diseases कि क्या हम monsoon में ये बारिश में क्या contract ना करें. So let's start discussing about it. So what is the major concern that one has to take care when it is flooding? Actually, North and Northwestern India have experienced severe rainfall and waterlogging and flooding. So what should one be careful of?
So I think stagnant water is a good breeding place. जहाँ पे भी water होता है वहाँ पे mosquitoes flare up करते हैं. Mosquitoes आने से you get diseases like chikungunya, like malaria, because they are mosquito-borne diseases. Now, chikungunya and malaria, sounds very fascinating big words. Chikungunya sounds like a bird, but actually chikungunya comes from the word, it's a Tanzania word, and it means to become convoluted. So basically in chikungunya, because it affects the joint, people stoop down because of the severe joint pain that is there. So that's why it's called chikungunya. And malaria, it is called malaria because Italian में bad air को malaria कहते थे. They used to think that it is an airborne disease. But because it's a mosquito-borne disease, both are mosquito-borne disease. So one important thing that we can take care of is don't have stagnant water around your house. And that water should be replaced every 2 days. Secondly, अगर आपके घर में आप उस एरिया में रहते हैं जहाँ मस्कीटोज इन्फेस्टेड हैं तो मस्कीटो नेट्स, बचपन में तो हम मस्कीटो नेट्स में सोते थे लेकिन आजकल in modern technology, if I tell my son to sleep in a mosquito net, he'll feel suffocated कि कोई उसके चारों तरफ कुछ बांध दिया है. So nowadays you get a lot of mosquito repellents, stickers. Even if you go in flights, if there are a lot of mosquitoes around you, they give you that sticker that repels the mosquito away. So those stickers are available nicely on internet or on stores that you can use. Also
Yeah.
nowadays you have that spray. हमारे यहाँ तो पहले स्प्रे होता था बचपन में. आजकल वो
जी
पिचकारी की तरह स्प्रे होता था. आजकल तो नहीं है. You get this automatic spray that you can kill the mosquitoes. And most modern flats come with mosquito nets, or you can put mosquito nets. So I think that
correct.
is very important. Wear full
Yes. So
sleeves.
shielding yourself from mosquito bites, whichever way that suits somebody, and water logging and breeding of mosquitoes avoid karna is something that you have highlighted.
It
Yeah.
is very important. And also, you see, when you go out in the open, try to wear full sleeves, because
Ha.
then the open area is reduced. Because
Right.
we have this feeling कि चलो shorts पहन लेते हैं, t-shirts पहन लेते हैं. You can, but if those areas are mosquito infested, especially with the rain, the temperatures are going to come down. So the temperatures is going to come down. Wearing slight summery full sleeves and full trousers will reduce the risk of these mosquito bites that you may get. So those
Absolutely.
things have to be kept in mind, especially from a mosquito-borne infections like chikungunya and malaria.
या सेकेंडली डॉक्टर स्किन का क्या सोख होते हैं बारिश में भीग के घर में वापस आते हैं समटाइम्स वी डोंट नो व्हाट काइंड ऑफ वाटर इज कंटामिनेटेड हम लोग पानी में चल के जाते हैं सो स्किन का क्या इश्यू हो सकता है
तो इसमें जहाँ से आपने दो सवाल पूछा, एक तो हम पानी में चल के जाते हैं. आदमी को अपना चप्पल जूता ज्यादा प्यारा होता है उसके पाँव से. सो आप काइंडली चप्पल पहन के जाएं अगर पानी में वेट भी कर रहे हैं, बिकॉज योर फीट इज मोर प्रेशियस देन दैट स्लीपर एंड चप्पल. Because if
जी
something is going to bite you, it is going to bite you via the slippers. So the chances of biting will be much reduced. That is going to be there. So always wear your slippers when you're going to wade up in water. As soon as you come out of that water, please wash your feet, because that
हम्म
water may be contaminated. You see, there is a condition called leptospirosis, which affects from contaminated urine of animals, especially rodents, rats, and these also causes high fever. सो लेप्टोस्पायरोसिस के लिए अगर आप कोई गंदे पानी में जा रहे हो, तो अगर चप्पल पहन के जाएं, आने के तुरंत बाद आप पानी से अपने पाँव धो लें, दैट इफेक्टेड दैट एक्सपोज्ड एरिया व्हिच हैज waded in the water, so that the risk of contamination is reduced. So that is
वाह
very common. Leptospirosis, we used to think that it is not, इंडिया में इतना नहीं होता, but it is very common. In fact, in Guwahati
इंडिया
also, India also, it's very common. Leptospirosis is quite common. And sometimes the leptospirosis can affect so much that it can affect your liver and the kidneys as well. So
ओ
it
माय गॉड
also causes with fever, headache and joint pain. So ये joint pain जो है, ये fever, headache, non-specific symptoms are very common in these tropical fever conditions. So one has to
राइट
distinguish between the two. तो ये अपने को ध्यान में रखने का है. अगर आप स्विमिंग भी करें तो स्विमिंग के बाद कितने जन बोलते हैं क्यों पानी से नहाना है. इसलिए नहाना है कि अगर वो वाटर कंटामिनेटेड होता है तो आपके when you're taking a shower in fresh water, it goes away. And that is why also when people go to a swimming pool, the rule is आप पहले पानी से अपने आप को wet कर लो, ताकि chances of passing things from you to other swimmers is reduced. So
Right.
those
So,
things are very.
secondly, before you get on to skin infections, there are a lot of people on YouTube chat who have joined us and asking. Avidas is suffering from under thigh itching, and Yoginder Kumar फुंसिया आ रहे हैं. Then Manish Naik, 52-year-old father है, hives है, a lot of itching है उनका. Then a lot of people are asking about skin rashes, itching, and infections.
So I think that is quite common. You see, as moisture is a breeding place for fungus. Whenever there is moisture, fungus breeds. So the inner thighs, which are high, areas of or joint areas, which are high areas where the water or the moisture remains. So those
जी
places, आपको fungal infection जो होगा, उसको हम जो thighs में होता है उसको tinea cruris कहते हैं, because of the crux of the joints, and tinea is fungus. So you might require an antifungal cream or an antifungal tablet that is there. You'll have to keep your sugar under control, because that will flare up the fungal infections as well. These areas should be kept dry in monsoon, because already there is moisture. You may
जी.
want to use an antifungal soap which is available. Your doctor may advise you, your local doctor. Keep these areas moist in people, especially अगर आपको risk of पहले fungal infection होता है, itching in the genitalia है, तो you must keep these areas as dry as possible. We use water a lot when we go to the toilet in Indian conditions, which is hygienic. But after that, please use a small towel to keep it dry so that there is no moisture left in the genitalia.
Yeah.
Second, आपने जो बोला और itching because so many insects are around. Even yesterday in my society there was a message कि हम शाम को swimming गए इतने सारे insects थे. तो monsoon में काफी insects होते हैं and they may bite you wherever you might not know. So I think keep some anti-allergic with you at all times. I think that is
जी.
very very simple. कोई भी दो तीन मिलते हैं बाजार में. I'm not endorsing any brand. Anything you can keep, especially if you are at risk of asthma or you are asthmatic, or you've got eczema or you've got dry skin. You must keep some anti-allergic with you at all times. ताकि आपको अगर ज़्यादा itching हो तो आप एक anti-allergic खा लो. दैट इज उसके बाद ठीक ना हो तो उसके बाद यू कैन विजिट अ डॉक्टर. लेकिन वन थिंग इज
Yeah.
इम्पोर्टेंट. वी से इचिंग हो रहा है बट ऑल्सो लुक एट द एंड्स ऑफ योर स्किन. अगर आपके पाँव के बीच में कहीं कट हो गया है तो कोई इंसेक्ट ने वहां पे बाइट किया है तो एंटीबायोटिक की भी दरकार हो सकती है. स्पेशली इफ देर इज फीवर, इफ देर इज पेन, देर इज रेडनेस, सो देन यू माइट नीड एंटीबायोटिक्स बिकॉज बाइट के कारण इचिंग हुआ है एंड टॉक्सिन्स जो वो जिस जो भी इंसेक्ट ने किया उसके कारण आपको स्किन इन्फेक्शन हो सकता है. तो
Yeah,
इफ
that's the
अगर
next level of infection. So primary reason कुछ और होगा, but वो बढ़ गया
लेकिन
हो सर.
बढ़ गया होगा ना, क्योंकि देखिए हमारा जो इंटैक्ट स्किन होता है उसमें बैक्टीरिया होता है. वी ऑल हैव
हाँ.
बैक्टीरिया roaming around our body. Now, whenever
Right.
there is a cut or there is a breach of the skin, that bacteria will go inside. When that bacteria will go inside, it will breed an infection. सो बिकॉज कोई
Absolutely.
चीज ने बाइट किया, कहीं से कट गया, तो वो आपका स्किन का जो बैरियर है वो कट गया है. तो वो इन्फेक्शन अंदर जाके आपको यू मे नीड एंटीबायोटिक्स. सो इफ इट डजंट सबसाइड यू मस्ट सी योर लोकल डॉक्टर who will be able to help you with that antibiotic to
Right.
sort it out.
So here there's a question about a child who is suffering with infectious little boils on the body. योगेंद्र कुमार वशिष्ठ, इनके दोनों लड़कियां हैं 5 साल की और 8 साल की. दोनों के लेग्स और हिप्स पर फोड़े और फुंसियां निकल रहे हैं. इसका क्या कारण है और क्या इलाज मैं करवा सकता हूँ? आई नो दैट यू आर नॉट अ पीडियाट्रिशियन बट स्टिल ये मॉनसून
अच्छा.
रिलेटेड है क्या?
अच्छा, सो जोगिंदर जी दो चीज आप ध्यान रखिए. कोई भी चीज अगर एक स्पेसिफिक टाइम में होता है देन इट इज रिलेटेड टू इट. अगर उनके बॉइल्स या उनकी फुंसिया या उनको जो भी स्किन का प्रॉब्लम है पूरे साल चलता है तो इट इज नॉट मानसून रिलेटेड. नंबर वन.
हम्म.
नंबर टू,
हम्म.
अगर आपके घर में कोई आपने नया वॉशिंग पाउडर, कोई सोप, कोई परफ्यूम नया यूज हुआ है उसके बाद से ये स्टार्ट हुआ है, सो देन इट इज एलर्जिक टू दैट स्पेसिफिक पाउडर, शैम्पू दैट पूरा घर यूज कर रहा है, because you're saying two people are getting infected with it. Thirdly, there are certain conditions in which it is transmitted from one person to the other, like scabies, especially अगर उनके joints पे fingers के बीच में जो finger webs है यहाँ पे, अगर इसमें effect हो रहा हो या genitalia में हो रहा हो, तो then this can be scabies and the whole house will need to be treated by a dermatologist. Other than that, generally a sign of itch means your allergic count is a little high. So an anti-allergic may be tried in such cases, and especially if they have any history of asthma, because that shows that they are an allergic prone person. The other reason that can be there, which is eczema. Now, eczema outgrows as the child grows older. So, I don't have photographs of your child, otherwise, I would be able to have to guide you. But there is a website called dermnz.com. You kindly go to that website. You can see the various conditions that are there. And if you find anything that matches for your child, you may be able to diagnose or take help from a dermatologist.
G, G. So here's an interesting question. YBSN Kishore, who's asking the question. I would want to know about the adult vaccinations for influenza, herpes, and others. 61-year-old. And monsoon, ये होते ही फिर next season भी influenza. What is the role of these influenza viruses and especially for elderly? Hepatitis का भी क्या vaccine है?
तो आपने तो सारा वैक्सीनेशन पूछ लिया एक एक करके.
How I
So
wanted
you
to touch vaccinations also. A good time
So,
to explore.
I think you see there are few aspects that one has to understand. So one is infection. आपने जो vaccines पूछा, in children in India, we should actually जब बच्चे होते हैं उनका एक vaccination schedule होता है. That should be
जी.
followed. So basic vaccination should be done. Immunization should be done for everybody as to the government guidelines that is there for all child. When it comes to adult, what vaccination can be done? See, you have to understand no vaccination is 100% protective. It cannot
Absolutely.
guarantee. Yeah, so it will minimize, there are chances 85% specificity or sensitivity, 90%, 95%, or it may reduce the intensity of the condition. What in vaccination you are doing, the basic funda is that you are giving minute dose of that bacteria or that virus in your body, and your body is reacting to it by producing antibodies. So that next time that bacteria actually bites you, you already have that antibodies to fight that, infection. That is the whole concept of immunization, and that is why some vaccination you require 2 or 3 doses कि आज मैंने आपको sensitize किया, फिर कल वापस आपकी बॉडी पे हमने थोड़ा और किया किसी द बॉडी इज गुड एनफ टू अटैक और थोड़ा और एंटीबॉडीज बढ़ाया. ऐसे करते करते हमने आपकी पूरा वी हैव क्रिएटेड अ फॉर्ट अराउंड दैट इन्फेक्शन, so that when
Right.
next time actually the whole army attacks, you are ready to fight that infection. Now you ask me what vaccination we should do. So there is vaccination. जैसे आपने पूछा chickenpox. There is some chickenpox vaccination that has come out. But what is chickenpox vaccination or varicella vaccination? Chickenpox हमें सबको होता बचपन में. इनफैक्ट बचपन में chickenpox होना बहुत अच्छी बात है, because you
जी.
develop immunity for the rest of your life. जनरली एक बार जब chickenpox होता है तो एडल्ट में नहीं होता, बिकॉज यू ऑलरेडी देयर. लेकिन जिनको बचपन में नहीं हुआ है उनको सीधा एडल्ट में अगर चिकन पॉक्स होता है तो काफी मुश्किल होता है. उनको चेस्ट इन्वॉल्वमेंट हो सकता है, आईज इन्वॉल्वमेंट हो सकता है. ऐसा हो तो इमीडिएटली डॉक्टर्स के पास आपको जाना चाहिए. There is some vaccination that has recently come out for chickenpox. It is varicella, which is very expensive. So a
Mhm.
decision has to be made by your doctor and yourself whether the price is good enough for you, or whether you feel that that is value for your money or not.
जी. जी.
जनरली फ्लेयर अप जैसे ही आपको चिकन पॉक्स होता है, वो वायरस आपके नर्व्स में सो जाते हैं. जब आपकी बॉडी की इम्यूनिटी डाउन होती है, अगर आपका समझ लीजिए HIV हो गया, कोई इम्यूनो कॉम्प्रोमाइज डिजीज हो गई, तब वो जब बाहर निकलता है तो उसको हम लोग हर्पीस की तरह वो निकलता है. सो दैट इज वेयर द चिकन पॉक्स वैक्सीन इज. देयर इज वैक्सीनेशन अराउंड हेपेटाइटिस which one should do, because hepatitis B, C, A can be prevented. There is vaccination around typhoid also, which is available, that one should discuss with your doctor whether it is there. But most important vaccination जो आपने शुरू में पूछा, that is influenza. Now
Yes.
influenza vaccination जो होता है वो साल में 2 बार आता है. One from the north, the viruses from the north, and the viruses from the south. तो साल में 2 बार इसके vaccination बाजार में available होती है. And
अच्छा.
what they are doing by this vaccination, one comes around June, July, one comes around December time. And what it tells you is that they are keeping in account कि उस हेमिस्फीयर में जो वायरसेस आ रहे हैं, इन्फ्लुएंजा कॉमन कोल्ड वायरसेस, फिर उसके हिसाब से हमने ये वैक्सीन इस बार प्रिपेयर किया. तो
Correct.
so you should either take it, if you have taken it June, July wala, you don't need to take December, because you cannot have vaccination twice a year. But people whose immunity is down, like diabetes, like जिसको asthma, या जिसको chronic conditions हो, या तो उनको इन्फ्लुएंजा वैक्सीनेशन या फ्रीक्वेंट कफ एंड कोल्ड होता हो उनको हर साल, तो उनको इन्फ्लुएंजा वैक्सीनेशन एल्डरली को लेना चाहिए. इट इज एडवाइजेबल, unless there are reasons why you should not be taking it, which your doctor would know your history, medical history better, कि नहीं आपको नहीं देना है. Otherwise it is very very useful, because what we हम लोग सोचते हैं अरे 1,000 रुपये वैक्सीन में चला गया, 1,500 वैक्सीन में चला गया. बट आपकी जो मॉर्बिडिटी है वो 5 दिन आप काम नहीं कर सकते हो सर्दी खांसी में. यहाँ से सर्दी खांसी इज अ मच मोर डिफिकल्ट एलिमेंट टू ट्रीट देन एनी अदर, बिकॉज अदर बॉडी परेशान हो जाती है, सो योर 5 days of productivity is gone.
Yeah,
Is that
absolutely.
equivalent to your life? So that is what you have to think and calculate.
Mhm.
But I would
Yeah.
definitely recommend influenza vaccination. Whether आप उसको जो टाइम पे लो उसको हर साल लो. अगर आप जून जुलाई में लेते हो तो वो जून जुलाई वाला जो नया सीजन आता है, what you should be careful इज डेड स्टॉक को अपने ऊपर आने मत दो। अगर जून जुलाई के समय आप हो तो वो नया वाला उसको बोलो कि अभी जो आ रहा है ना वो जुलाई वाला वो दो, मुझे दिसंबर वाला, आई डोंट वांट दैट दिसंबर
How do you?
वैरायटी का।
It's a very very important point that you have mentioned. कि how does a common person understand कि ये वैक्सीन टाइम ऑफ मैन्युफैक्चरिंग लॉट देखना चाहिए या उसका कुछ लिखा रहता है? What is it
एक्सपायरी डेट
that?
रहता है ना, तो एक्सपायरी डेट रहता है, सो देयर इज एन
Ah,
एक्सपायरी डेट। सो एक्सपायरी
okay,
डेट से जितना नजदीक हो कोई भी दवाई और वैक्सीन जहां तक हो सके आपको अवॉइड करना
okay,
नियर द
okay.
एक्सपायरी डेट। अगर आप कोई फार्मेसी में भी कोई दवाई लेने जा रहे हो, समझ लो वो 2 साल की वारंटी है उसमें, और 2 साल मैन्युफैक्चर और एक्सपायरी में 2 साल है, 1.5 साल है, तो जस्ट नियर द एक्सपायरी डेट अगर 1 1.5 महीना हो तो वो तो आपको ऑब्वियसली ही वुड बी मोर इंटरेस्टेड इन गेटिंग स्टॉक्स आउट। सो यू हैव टू बी स्मार्ट एंड सेइंग कि भाई ये तो नहीं, मुझे थोड़ा फ्रेश वाला आप दे दो, बिकॉज
Okay,
थिंक यूज देयर potency near the expiry time. So that
right.
So that is something you can watch out for. Especially in vaccination, also they come with some expiry date, so you will get an idea whether it is or not. And if you quiz the doctor who is giving you कि ये नॉर्थ वाला है इन्फ्लुएंजा या साउथ हेमिस्फीयर वाला है, when you ask him that question, he will understand that you know about it. So then obviously
Hmm.
you can have that discussion that I know about it. तो आप मुझे वो
Correct.
वाला बताओ, लेटेस्ट वाला आप मुझे दे दो। So ये आप
Yes.
कर सकते हो, that should be done.
Right. Here's another vaccination related question from Renuka Sridhar. Renuka is asking, are there any vaccinations to avoid asthmatic conditions in monsoon? Any recommendations, doctor?
So I'm not aware of any vaccination to prevent asthma in monsoon. बट मानसून में मॉइस्चर होता है, मॉइस्चर से आपका अस्थमा फ्लेयर अप हो सकता है। जनरली आपके पास दो इनहेलर होगा, एक ब्लू इनहेलर होगा, एक ब्राउन इनहेलर होगा। तो आपके जो ब्राउन इनहेलर है विच प्रिवेंट्स अस्थमा, प्लीज यूज इट ऑन अ रेगुलर बेसिस, एंड ब्लू inhaler you keep it on standby with you at all times. When you get a flare up you use the blue inhaler. Your doctor, your asthma doctor may also prescribe you some other color like green color inhalers which may be needed specifically for your condition. But I'm not aware of any specific vaccine, monsoon specific special asthma vaccine. But it's an interesting question. I will tell my pulmonologist to try to do research in this, and perhaps we will ask Serum Institute of India to see अगर कुछ निकल सकता है।
Interesting cook there. Right. Next question is Gaurav Joshi, who's moving to a high malaria affected country for work, which is also most rainfall infested area. How can I prevent or be safe from yellow fever and malaria? In one case, my friend did get a vaccine for yellow fever, but after 4 months, he went through malaria.
एक तो अगर आप येलो फीवर एरिया में जा रहे हो तो आपको वीजा ही नहीं मिलेगा जब तक आप येलो फीवर का वैक्सीन लेके नहीं जाओ।
Ah,
In some
right.
places they are, this is mandatory, and your travel agent will recommend you do a yellow fever vaccination, तो वो तो आपको करना ही है, वो तो कहानी खत्म। मलेरिया के लिए यू हैव टू कीप योरसेल्फ सेफ, वी डिस्कस्ड व्हाट वी कैन डू, wear full sleeves, use mosquito repellents, use mosquito nets, get used to sleeping in mosquito nets, have that mosquito bat, but try not to electrocute yourself with the mosquito bats as well, because sometimes, and make sure कि एक एक्स्ट्रा बैट हो, बिकॉज वो 1 महीने में उसका चार्ज उड़ जाता है। चाइनीज बैट मत खरीदिएगा, तो वो आप एक दो बैट लेके जाए, वहां मिल जाना चाहिए आपको, बिकॉज बट दिस मस्किटो बैट्स आर वेरी हैंडी, that comes, but the unfortunate thing is that they run out of battery. I don't know what happens after 1 month, it stops after 2 3 weeks of time. So
Yeah,
everybody
yeah.
has this problem. I'm sure हैदराबाद में भी यही प्रॉब्लम होगा जहाँ से मस्किटो
जी,
बैट्स
जी,
का।
जी. More the business that they want उनका काम कम करेगा sir. That's the only thing I can say. But
Exactly.
honestly, note precautions are better in malaria, and malaria पे जो युद्ध हम लोग इतने सालों से इतने centuries से हम नहीं कर पा रहे हैं. So we don't have a treatment or prevention rather for malaria.
Yeah, but I would say, see, when I was in my medical school, I'm saying 25, gosh, more than 25 years ago now, malaria was rampant. अभी मलेरिया
Absolutely.
कम, अभी हमें कम सुनने को मिलता, बहुत कम। I'd say
Yes.
बहुत कम सुनने को मिलता है मलेरिया हो गया, मलेरिया के एंड डेथ हो गया, बिकॉज एक तो टेस्टिंग ज्यादा फास्ट हो गई है, बिकॉज एवरी लैब विल हैव अ मलेरिया टेस्टिंग किट। तो आपको फीवर, वैसी फॉर फीवर वी डू अ ट्रॉपिकल फीवर पैनल नाउअडेज। इफ यू आर
Right.
कमिंग फीवर इन इंडिया, अगर आप बुखार लेके, चिल लेके, राइगर लेके आ रहे हो, So we have to find out whether you have any specific which infection you have. If you're coming
Right.
with urinary symptoms, then we are thinking urine infection. If you're coming with chest symptoms, we'll do a chest X-ray to see that chest symptoms. Hai ya nahi? If you're coming with neither and you are just coming with fever, headache, maybe a little bit
Body
of chill, body, then we do a full tropical fever screen. आजकल हर जगह अवेलेबल होता है, हमारे यहाँ अपोलो गुवाहाटी में अवेलेबल है, in which
It's
we check
available
your.
on Apollo 7, doctor. Let me take that note here that there are doctor recommended tropical fever and fever profile tests available on Apollo 24/7. We can leave a description box. May we can leave a link to it. Yeah, please
Yeah,
continue,
so
doctor.
it comes, you fatafat you check for dengue, that includes leptospirosis, that includes typhoid, that includes malaria. So you can easily have that basic screening done. This is more useful if there is an absence of symptoms or specific condition. अगर आपको खांसी है और फ्लेम निकल रहा है और बुखार है तो चेस्ट इन्फेक्शन ही है ना, उसमें आप ट्रॉपिकल फीवर स्क्रीन करा के जनरली कोई लॉजिक नहीं होता, अनलेस यू आर स्टक एंड कुछ नहीं मिलता. आपको प्योर यूरिन सिम्टम्स है तो यूरिन चाहिए, आपको यूरिन इन्फेक्शन है या नहीं है. लेकिन अगर ऑल दिस नॉन स्पेसिफिक सिम्टम्स आर देयर, it can be something else also, but a tropical fever panel has made life very easy. In fact, even when we write tropical fever panel, तो पेशेंट साइकोलॉजिकली फील एक ही टेस्ट करा है. अगर हम ये 5 डिजीज का अलग अलग लिखेंगे, उसको बोले डॉक्टर साहब इतना टेस्ट करा दिया आपने, कितना ब्लड लेंगे मेरे से. So India is also a matter of the mind, and it also cost effective. When you do it as a panel, it becomes cost effective for
Correct.
the patient.
Absolutely. Absolutely. So as we are talking about fever, let's also say कि बारिश में हम लोग जो इतना we have been through the pandemic and we've learned a lot through our isolations and quarantines. Do you think that those lessons are absolutely necessary surviving monsoon infections? जैसे cold हो गया, किसी को fever है, ये contagious है क्या? How do we protect ourselves?
So I think more than COVID has taught us one thing: enjoy your life. अगर अगर आपको बारिश में भीनी भीनी बारिश में चाय पी के बगल में एक समोसा या पकौड़ा खाने का मन है तो प्लीज खाएं कभी, बिकॉज जिंदगी एक ही बार आती है, तो यू एंजॉय योर लाइफ ऑल्सो, बट यू नीड टू बी सेंसिबल. अगर आप जाके बारिश में भीगना चाहते हो 2 मिनट के लिए, 5 मिनट के लिए, बचपन में तो हम नहा लेते थे बारिश में, वो तो हम अपने बच्चों को अलाउ नहीं करते आज के दिन. लेकिन अगर आप 2 4 5 मिनट भी जाओ एंड यू वांट टू फील दैट एयर, don't stop yourself. Sometimes you want to jump in a muddy pool of water to bring your child to do that, but after that ensure that you have cleaned yourself well, ensure you use fresh water, you're not contaminated. So that is very very important. But what also, you see, a lot of respiratory infections are transmitted. अगर आपको कोई भी virus infection है, especially upper respiratory cough cold, there's a chance of movement from one person to the other person. So that one has to be sensible in general, not just COVID. But we never used to be that sensible. Now people are more sensible uh, on that. So you must use disposable handkerchiefs, that rather than your own, because that has to be washed with all the clothes of the house, because एक ही washing machine होता है घर में. अगर कोई बीमार है उसके लिए आप नया वॉशिंग मशीन नहीं ला सकते हो, या उसका कपड़ा अलग नहीं धो सकते हो. तो पहले तो उसमें हम डिटॉल डालते थे कोविड में, और ये करते थे वो करते थे. इवेंचुअली पीपल गॉट टायर्ड. So you can use a lot of common sense that is there. More importantly is keep yourself well hydrated. इसी
हाँ.
झांसी, जब हम बचपन में थे ना, तो एक बहुत कोट हमें बोला जाता था, यू फीड अ कोल्ड एंड स्टार्व अ फीवर. ये हमने बहुत सुना है, बट दैट्स अ मिथ.
अच्छा, it's
Because
a
see,
myth.
it's a myth. Because see, whenever your body is down, your body needs adequate nutrition. Your body is under attack. So your body needs rest, plenty of fluids, and plenty of nutrition to fight that invading organism that is there, be it a virus, be it a bacteria. So it's in a catabolic state. So you need to support your body with that. ऐसे नहीं कि मैं नहीं खाऊंगा. आपको मन ना करे तो आप उसको लिक्विड ज्यादा खाओ उस समय. Especially for children. You see, when children have fever, they stop eating. So best
Yeah.
time to feed a child when it is fever is कि आप उनको एक, अगर फीवर उतारने का पैरासीटामोल दे रहे हैं, उसके 45 मिनट्स के बाद ही उसके सामने खाना रखें, क्योंकि
अच्छा.
तब उसका बुखार उतर चुका होगा, तब वो बच्चा खा लेगा. लेकिन अगर आप उसको बुखार के बीच में खिलाने का कोशिश करोगे तो दैट ही इज नॉट गोइंग टू, ही माइट फील सिक, ही माइट नॉट लाइक टू डू इट. So a child, we all से चाइल्ड हल्ला गुल्ला करता है, लेकिन हमारी बच्चे जब चुप हो जाते हैं तो हमें सबसे तकलीफ पेरेंट को ही होता है कि वो चुप क्यों हो गया भाई,
हाँ,
बच्चा चुप हो गया है. So we want them to be the way they are. So feed them when the fever is down. That is the best time to feed them, and feed them what they like. उस समय पेरेंटल स्किल्स को आप खिड़की से बाहर भेज एक दो कि भाई हमें कोल्ड ड्रिंक नहीं पिलाना, हमें लिक्विड नहीं पीना, हमें ऑरेंज जूस नहीं खिलाना, हेल्दी खाओ. वो हेल्दी का जो पर्चा है वो आप बाद में कराएं, पहले उसको कुछ शरीर में उसको जाने दें.
right. And
सॉरी
also hydration. Hydration
आई.
for adults, sir. As you say, I noticed that my general consumption of water also goes down in the colder seasons. So one should
Exactly.
actually put some more effort in hydrating ourselves.
Yeah, see, because especially in, when there is heat. Say when there is heat, we say 500 ml of water is lost in your sweat and your urine. Other
Yeah.
than that, आप जितना लोगे उतना निकलेगा. और अगर गर्मी में तो आपको पसीना ज्यादा आएगा तो ज्यादा लॉस होगा. So I think it's very difficult because in cold, especially people don't because they have to go to the urine, pass urine in the toilet और ठंडा रहता है बार बार जाओ बार बार आओ. But at least 2.5-3 liters of liquid is very very good, uh,
Yes.
you know, for people in general. And
Yes.
especially अगर आप जैसे when people have typhoid or people have diarrhea as a predominant symptom in tropical disease, अगर आपको diarrhea ज़्यादा
Absolutely.
then you should have fruits which are rich in water, like watermelon, like sweet melon, like grapes, ताकि liquid consumption is good. माउथ का जो फ्लेवर है, क्योंकि आपको बुखार में कुछ खाने का मन नहीं करेगा, डायरिया होगा तो you can have you know rich in water fluids or fruits which are rich in water for yourself.
Yes. Yes. Manish Sharma ji पूछ रहे थे dengue के बारे में, but today I think we've done an extensive episode on dengue, chikungunya, and malaria. So we'll leave a link there, Manish Sharma ji. That will be taken care there. Next question is of his same typhoid के बारे में पूछना चाहते हैं, and also cholera. Let me also ask somebody else's question. So here's Raj. Doctor, 2 days ago I had fever with vomitings. I'm feeling very uncomfortable vomiting hone tak. And after the vomiting, after throwing up, I'm feeling better. I would want to know, is this food poisoning or any other kind of fever?
See, Rajji, we all like our puchkas and mudi in India. ठीक है, और उसका फ्लेवर तभी आता है जब वो बनाता है. वो फ्लेवर आपके घर में नहीं आता बिकॉज यू कैन इमेजिन द अमाउंट ऑफ कंटामिनेशन दैट इज देयर. इनफैक्ट दैट इज पीपल से वो आपकी इम्यूनिटी भी बढ़ाती है. सो वी आर एक्सपोज टू अ लॉट ऑफ पैरासाइट्स, वी आर एक्सपोज टू अ लॉट ऑफ बैक्टीरिया इन इंडिया. दैट्स व्हाई आवर इम्यूनिटी इज वेरी गुड. गोरा को आप इंडिया में ले आओ, इट विल कॉज अ मेजर हैवॉक फॉर देम. I remember when I was in UK, the day I used to come in India, after 2 days I would have diarrhea because my body's immunity would have gone for a toss. So we have very good immunity in India because we are exposed to so much variety of bacteria and parasites that are there. Now, so our body is used to fighting these. तो अगर आपको वॉमिटिंग हुआ है, डायरिया हुआ, एक दिन में ठीक हो गया तो ठीक है, कहानी खत्म. आप थोड़ा लिक्विड पीजिए, काम खत्म, चिंता करने की कोई बात नहीं है. लेकिन अगर ये परसिस्ट करता है एंड यू फाइंड थिंग्स आर नॉट इम्प्रूविंग, then you need to consult a doctor because you may need, even though when we say most common in India is viral diarrhea, which is self-resolving, but
Right.
sometimes there is contamination by bacteria also. So you may want to see your doctor for advice, whether it is viral, whether it is bacterial, whether you need more, especially if the number of motions are high, there is blood, you are having high fever, you may want to consult somebody for treatment, especially if you're puking. See, normally हम क्या कहते हैं कि भाई आपको चलो डायरिया हो रहा है, हम आपको रिप्लेस कर रहे हैं. When I was in my medical school, we used to have this ward in which, if you had diarrhea, they would not give you antibiotics, they just give you fluids कि भाई वायरस को निकल जाने दो. लेकिन अगर आपको उल्टी हो रही है तो आप जो भी लोगे वो तो वापस निकल जाएगा. So if especially in child also, if you are having vomiting, there is chance of dehydration is higher. And for common people, two things which we can understand for dehydration. Number one, you press the pulp of your finger like this, the nail. अगर उसका
The nail bed.
कलर, द नेल बेड, आप इसको प्रेस करें और छोड़ दें, अगर आपका कलर वापस आ जाता है 2 सेकंड में, तो हाइड्रेशन इतना खराब नहीं है. योर कलर, योर पिंक कलर और वॉट एवर योर नेचुरल कलर विल कम बैक वेरी फास्ट. If you're dehydrated, it will not come back. It will take a long time. If you're not passing enough urine, if your heart rate is very high, if you feel very thirsty, because these are body's immune mechanism or body's mechanism to actually control it. These are rough guides. This does not, substitute going and seeing a doctor. But definitely, I would take medical advice if you are symptoms are persisting for more than 24 hours, be it diarrhea, be it vomiting.
Right, doctor. Thank you so much. Quickly, before I move on to the next question, I would want our back-end team, admin team from Apollo 24/7 to take care of Mr. Rajesh Kumar's query. He has not received the quiz prize, and I'm sure that our team can take care of it. Please go ahead and address the issue, my team, back-end team. All right, sir. Next question is about skin rashes and body pain. Ankit Yadav, इनका age and gender मुझे दिया नहीं है, but rashes and body pain are they together or separately देखना चाहते हैं?
So they can come together, they can come separate. So generally, if you say body pain specifically, we think of a lot of viral pathology, कि viral infection, fever, body ache, मतलब शरीर टूट गया है, नहीं आपको बस बिस्तर से नहीं उठना है, आपको काम पे नहीं जाना है, आपको बॉडी को रेस्ट चाहिए. Let the body be rest. Body is asking you for rest. It's, when the body is under attack by virus, you want to get rested so that the most viral illnesses are self-resolving. A lot of viral illnesses also comes with rash. So that's a typical pathology. Fever, rash, body ache, maybe joint ache, this is viral symptoms. But if they are not resolving within 24 hours, you please consult your doctor in person, not over phone. Because
हाँ
sometimes
हाँ
some signs may be there. phone पे क्या होता है बहुत कुछ मिस हो जाता है. Phone is
absolutely
okay for chronic conditions, कुछ advice लेना है, diabetes, thyroid, या आपको जो regular है, some conditions in which you can send a photograph, of your skin rash and you can speak to a dermatologist and see what it is. But in general, physical consultation is always better because you can see, you can hear, you can talk, you can reassure better. तो
जी
ये जो आपने symptoms बताए, these are all viral, suggestive of viral infection. So, and that happens,
yes
and these rashes are self-resolving generally. When everything
hmm
resolves, rarely, say for example, if you consider dengue में कभी कभी प्लेटलेट गिर जाता है तो रैशेज आते भी हैं. प्लेटलेट हमारी बॉडी को इन्फेक्शन के लिए फाइट करता है. So platelet count can go down and people can have some bleeding also because body platelet clot कर देता है. अगर कहीं कटता है हमारा तो वो जो एरिया बाद में काला काला बन जाता है, फिर वो नॉर्मल स्किन आ जाती है. दैट इज बिकॉज द प्लेटलेट कम्स एंड does that work. तो अगर आपका बॉडी की प्लेटलेट कम हो जाती है, दैट हैपेंस इन डेंगू. सो इन डेंगू इफ यू आर हैविंग one thing which you can do very normal in your house is eat papita. Papita is very freely available in India. Papita, there is evidence that papita helps the platelet count. In fact, some pharma companies have brought tablets of papita only and they are making money. तो आप पपीता घर में ही खा लें. That may help your platelet count, especially if you have dengue. Dengue होने से पपीता खाने में कोई नुकसान नहीं unless you are allergic to it. But you must take advice and you must watch your platelets and speak to your doctor who's treating you. Papita and pomegranates are quite good for condition like dengue.
yeah. And are there any foods that one should avoid in monsoon? I missed the name of a person who was asking what are the foods to be avoided, especially I have hives, rashes and urticaria in monsoon.
So I think there is no specific. People used to say there is a huge panel of tests you can do to find out आपको क्या चीज़ से एलर्जी है. But बोलना बहुत मुश्किल है. अगर if you're going to do a whole panel of finding out allergy, everybody will say allergic to dust. You can't live in a dust-free world, So you have to be realistic what it is. So what I was taught in UK when I was posted, because as part of posting you were in dermatology ward also, it was very simple logic. If you can identify a specific condition, कि मैं टमाटर खाता हूँ, after eating tomato I come up with a rash, then you do a test for tomato. But if you do a whole panel of tests and say you come mildly allergic to anda and your body needs anda, will you stop eating eggs? So that will play on your mind. So more
Yeah, पैन
importantly,
तो सब बंद करवा देता है सर एंड नॉन एलर्जिक चीजों को भी एलर्जी करवा दिखा देता है. So that's kind of a mind game.
it's a mind game. Every test has its reaction. So only do a test which is recommended by your specific doctor. If you do everything under the sun, something will come up. Then the question is, what are you going to do with the result? Because see, We have nowadays a lot of labs coming with this panel test of 800 rupees and 1000 rupees that happens full body screening. So I suggest आप कर लो और उन्हीं से ही दवाई लिखवा भी लो आप, बिकॉज आप फिर आर्सेनिक का लेवल हमारे पास लेके आओगे, मर्कुरी का लेवल लेके आओगे, कैडमियम का लेवल लेके आओगे, एंड यू लास्ट मी इट इज बॉर्डर लाइन ऊपर नीचे, अब हम क्या करें? एंड यू सेड आई डिड द टेस्ट बिकॉज इट वाज इन अ पैकेज. So, one has to be more specific. Say you are shopping and, Jhansi has gone to buy a sari. She will not buy, अरे सेल था मैंने 10 साड़ी खरीद ली, अब कब यूज करेंगे, we will see, and now she will find a problem. ये साड़ी में क्या हो गया? So do what you actually need to actually test, so that it makes clinical interpretation. The test that we do is to reconfirm our clinical diagnosis. Test is
Right.
never done to find, कि टेस्ट कर लो उसके बाद हम डॉक्टर को दिखाएंगे. पहले आप डॉक्टर को दिखाओ, और जो टेस्ट आवश्यकता है, हो सकता है आवश्यकता ही नहीं, अगर जो आवश्यकता है वही कराएं, so that is to confirm his clinical suspicion. See,
Right.
nowadays, all clinical, technical knowledge is going down because people come with us with, 30 pages of lab reports
Hmm.
or 20 pages of lab reports. Nowadays, they don't even come with printouts. They come in on the phone only. Sir, वो पीडीएफ में भेज दिया था लैब वाले ने, तो आपका आई पावर हमारा खराब होते रहता है कि उसको मैग्नीफाई करके देखते रहो आप उसको. It takes so much of time and energy, and sometimes you don't know why it has been done because patient also does not know. Now, if you
Correct.
find something abnormal, you will try digging up more and more and more and more. So, always do tests based upon your symptoms as advised by your doctor.
एंड ऑल्सो जो वही फूड अवॉइड करे जो आपको नॉन एलर्जी क्रिएट करता है. नॉट एवरीथिंग शुड बी अवॉइडेड. या एंड
And
इतना.
you
या.
can always do a test for those. अगर आपको
करेक्ट.
लगता है कि ये खा के मेरे को होता है, तो फिर वो इट्स अ डिटेक्टिव वर्क. आप यू सिट डाउन, in peace and think, is there something I've used lately? Is there a new tablet that I've used? Is there a new perfume I've used? और घर में मेड ने कुछ नया वॉशिंग पाउडर लाया हो, या यूटेंसिल्स आपने कोई चीज से नए, सम कॉमन थिंग्स इफ यू थिंक ऑफ, you will generally come to a conclusion what is happening.
एब्सोल्युटली. बट ऑन अ जनरल नोट सर, कि मानसून में फूड कंटेमिनेशन ज्यादा हो सकता है. गर्म चीजें खाने के लिए हमें बताया जाता था कि ठंडा कुछ मत खाओ. एंड जो भी रखा हुआ है थोड़े घंटों के लिए, दे आर prone to get bacterial contamination. So what's your advice?
So I think, see, there is a condition as we are aware of called typhoid. Typhoid happens when the food handler is contaminated, because
Ah,
typhoid का जो निकलता है bacteria that comes in his stool, and if he's not washed his hands and he is getting infected, if he's handling your food, if he's handling your water, you will drink that food and water. Though it sounds very gross, but those bacteria are so small you will not even know, and you will get the infection. So generally when we say अगर आपको milk भी पीना है तो boiled milk पीजिए. you know Raw vegetables भी आप, cooked vegetables खाएं, because chance of infection is less. So all this is very important. Contaminated food and water if you take, but sometimes we don't know कि क्या contaminated है, क्या contaminated नहीं है.
नहीं
And
है.
you always, हाँ, and you always, if your body is under stress, you only consume things which are easy to digest.
जी.
Don't consume things which are difficult. Already the body stress में है, आपका पेट दुख रहा है, आपको डायरिया हो रहा है, और आप फिर हाई, डाइजेस्टेबल, जिसको डाइजेस्ट करने में ज़्यादा टाइम लगे, आप पिज्ज़ा बर्गर बैठ के खा रहे हो, तो दैट्स नॉट वेरी गुड. तो यू कैन ऑलवेज हैव योर पिज्ज़ाज एंड बर्गर्स, बट नॉट व्हेन यू आर डाउन.
Yes, doctor. So that is it. One general information there. Next question is about is from Prithvi, जिनको जुकाम बहुत है, cold है, and when he got as a part of his health checkup, IgE showed up almost 469. So what is the importance of this IgE and how can you decrease it?
So, Prithvi ji, IgE high hai, this suggests that your allergy component. IgE is a test that is done to show whether your allergy levels are high. Now, अब किसके against high है, that is very difficult. तो
Uh,
अगर आपको IgE high है, you may try some anti-allergic. If that doesn't resolve, you may consult your doctor to find out the reason why your allergic component is a little high. Do you have asthma? Do you have eczema? Do you have any other things that you could be allergic to? Or you could have taken some medicines. But that is why I am, Prithviji, I am against this broad spectrum test, because then you have to interpret them.
Yes, okay. So I think you have answered the question elaborately even before I place the question. So that is self answered there. Next question is from both diabetic inquiries. One is Malti, whose mother suffers from diabetes and hypertension, but she's having of late all gastrointestinal issues and digestive issues. Second, Mohan Krishna, who's 30-year-old type 2 diabetic, hai, mandatory vaccinations for type 2 diabetic people.
So you should have your influenza vaccination every year. That is mandatory.
He's just
That you
30-year-old.
huh?
He's
You should.
30-year-old.
It is advisable if you can
Okay.
afford it. It is always good to have your vaccination, especially because diabetes is an immunocompromised state. Other than that, your general vaccination that you should have had in your childhood, you should always do that. Second,
Yeah.
हमारे यहाँ जो see I deal with diabetes a lot, but majority if I see 10 of my patients, 5 of my patients will always have gas का तकलीफ because they always have GI problems. Now these GI
Mm,
problems diabetes happens because of four reasons. Number one,
mm,
the patient is already a person is a person. He is also diabetic. So all conditions that happens in non-diabetic also happens in a diabetic. पैरासाइट्स बैक्टीरिया वायरस जो नॉन डायबिटिक को होगा वो डायबिटिक को भी होगा डायबिटिक को नहीं हो ऐसा तो कोई बात नहीं है नाउ देयर आर सर्टेन स्पेसिफिक कंडीशंस देन इन डायबिटीज जो हो सकता है दैट इज डायबिटीज कैन इफेक्ट द मोटिलिटी ऑफ योर स्टमक सो वो
mm, mm,
डायबिटिक हम लोग कहते हैं गैस्ट्रोपैथी हो गया उसके कारण कॉन्स्टिपेशन हो सकता है कुछ डायबिटीज दवाई से डायरिया हो सकता है कुछ डायबिटीज दवाई से कॉन्स्टिपेशन भी हो सकता है so
mm,
other
mm.
than all the other world common conditions that happens to everybody, some conditions are specific for diabetes related, diarrhea or diabetes के कारण आपके नर्व इफेक्ट हो गए आपके ऑटोनॉमिक सिस्टम इफेक्ट हो गए कॉन्स्टिपेशन हो गया एंड कुछ डायबिटीज की दवाइयां के कारण भी आपको तकलीफ हो सकती है ये आपका जो एंडोक्राइनोलॉजिस्ट होगा ही शुड बी एबल टू टीज दिस आउट एंड सजेस्ट मेडिकेशंस फॉर योर
Yeah. So, any specific precautions that one should take for monsoon while taking care of diabetes?
See, people have this tendency when it's raining to have a cuppa of tea and to have more snacks. So I
Ha.
think that, and then your tendency to move out is reduced. Your physical activity will be reduced. So a lot of exercises that you can consider home exercises if you are used to going out in the gym or running around, तो वो आपका एक महीना सब गड़बड़ हो जाएगा जब वो एक महीना गड़बड़ हो जाएगा तो आपका इकोसिस्टम खराब हो जाएगा तो try to build something in the house that you can do in the house that you can do कभी कभी you cheat is okay but cheating should not be a norm if you are
Yeah.
going to cheat also cheat in a legal way अगर आपने कुछ आज खाना भी है once a month अगर आपने कुछ आज बहुत मन कर गया then you balance the calorie out by reducing your meal somewhere तो अगर
Okay.
आपका कुछ मन कर गया है तो you balance the equation out don't stop living your life but that cheating should not be a norm it should happen very very occasionally और कभी मन करता है we are humans and I'm sure we all like and the more you restrict the more you say नहीं खाना वही दिमाग में ज्यादा दौड़ता है so in fact even in my diabetic patients I say if you really want to have a piece of chocolate please don't buy the sugar free chocolate because see when you are having the chocolate why you want the chocolate because chocolate will give you satisfaction on your tongue and you will have satiety in your brain that is why you're liking it because it gives you that sense of fulfillment sense of satisfaction we all love the Cadbury's ad that we have seen over years and years that brings happiness the chocolate brings happiness and that is all that is circulated yes some hormones are secreted that might bring happiness बट इफ यू आर गोइंग टू हैव द शुगर फ्री चॉकलेट तो आप शुगर फ्री का दो तीन पीस खाओगे और चॉकलेट का एक छोटा पीस खाओगे तो मोटा मोटी बराबर हो जाना है काम और आपको सेटिस्फैक्शन भी नहीं मिलना यू आर गोइंग टू बी अनहैप्पी एनीवेज so if you're really really wanting to have a small piece but reduce your meal have it at meal time reduce your meal with that small piece of chocolate but this should happen maybe once a month not always
Right. So this is also for non-diabetics like me, who बाहर का जो तापमान है, जो मौसम है, वो बाहर जाने नहीं देता है. And there's so much of lethargy, there's so much of fatigue. So बस सोने
हाँ
का मन करता है. And also, let's talk about anxiety, stress, and depression, PTSD, which might aggravate in this kind of season. कुछ यहाँ आपकी विशेष
या
टिप्पणी
तो
प्लीज.
ये तो एग्जाइटी डिप्रेशन होता था पहले जब हम न्यूक्लियर फैमिलीज में रहते थे। आजकल हमारी न्यूक्लियर फैमिली में एक फैमिली मेंबर ऐड हो गया, उसको हम कहते हैं ओटीटी चैनल्स एंड मोबाइल्स। तो आपकी सोशल मीडिया और आपका जो ओटीटी मूवीज रहेंगे वो आपको इतने एंगेज करते हैं। इनफैक्ट आई वाज वाचिंग अ सीरीज एंड यस्टरडे एंड दे सेड अ वेरी नाइस थिंग। यू रिमेंबर व्हेन यू वाचिंग अ सीरियल एंड उसके बाद उसका नेक्स्ट एपिसोड आता है, they don't let you relax. They said next episode starting in 5, 4, 3, 2, 1, start.
हाँ
Because
हाँ.
they do not, they
और
want
क्लिफ
you to
हैंगर पे
keep
भी
on.
छोड़ते हैं, आपको रोकने
हाँ,
नहीं देते, क्लिफ हैंगर छोड़ते हैं.
exactly, because they want you to be watching them engage there, and that's why just they think it was a program on casino, and that's why they say in casinos also you get this bright lights, there's golden lights, this music sound which is on C note, so that the people are so engaged in it that they did not see whether it's din, whether it's raat, they just want to sit there and they want to make the money. So OTTs have really taken that away, but you know what? And there was another quote that which say that you may have 1,000 friends on Facebook, but in real, you may not have one or two friends also. So all the likes that you may get on Facebook are not true likes. They are just likes, maybe out of jealousy, maybe they may harm you. So cultivate friends. We have lost the communication skills in this era of OTT and artificial intelligence. Cultivate friends you can call for a cup of tea, or you can go for a cup of tea and in the rain. That is the best kind of anxiety relief, stress buster, your best friend.
Yes, yes. Thank you so much, Doctor. And one more question or important monsoon survival tip. We would want to talk about accidental falls. And बाहर भी इतना risk है कि potholes हो सकते हैं, manholes खुले हो सकते हैं. So we should talk about emergencies in monsoon as well.
So I think you brought a very interesting concept of potholes. In fact, in Guwahati last month only, a girl, because pothole tha and barish ho rahi thi, school bus was going at normal speed. The class 12 child, she was on a scooter and got stuck in the pothole, fell over and died on the spot. So potholes, you must be aware of potholes. Number two, you must tell where you're going to people कि मैं यहाँ से वहाँ जा रहा हूँ. Somebody in your family member, message that I'm going from here to there, so that if there is a problem, you can be traced. Your mobile should be there so that you can ask for help, and you must have some money with you in case of emergency. That is very very important, especially if you are allergic to something. In England we used to have a bracelet or a neck mein kuch, so that you can identify I'm a type 1 diabetic, or I'm asthmatic, or I'm allergic to this antibiotic, so that all is there. Still, we would like potholes are made to, they try to improve things. I think thoda kabhi kabhi time lag jata hai, but I think the government is also trying its best what they can to improve the conditions that are there. But rain के कारण कभी कभी visibility खराब हो जाती है. So I think one has to be very careful and sensible, and that is why I said नंगे पाँव आप ना जाओ, आप अपना
जी.
footwear रखो and have your sensibilities. I think accidents do happen, that is part of life, and
Hmm.
especially for parents who are 35 plus, I would say you must have a term insurance. I'm not selling term insurance, I'm not an agent, but COVID has taught you to have good term insurances. So do have a
Yes.
term insurance policy, because you never know when life is saying bye bye to you.
Right, right. So also on that note, घर पे भी slippery floors हो सकते हैं या accidental falls हो सकते हैं. One should be cautious and keep their guard on.
हाँ,
Ruchika
तो
was
घर में
asking.
पाओगे झांसी, आजकल तो कोई ओपन हाउस में अफोर्ड ही नहीं कर सकता ना। सब तो फ्लैट्स में रहते हैं, तो फ्लैट्स में पानी कहाँ से आएगा अनलेस देयर इज अ लीकेज. बट द वरांडा कैन बी देयर, आई
Common
गेट.
areas हो सकते हैं, balconies हो सकते हैं. There's so much of slippery floor का risk हो सकता है. And
जनरली इन
also
योर,
the algae which settles down, especially on the waterlogged area, you don't even know how slippery that can get.
so that is why they say in bathrooms, you see, or in your balconies, you should always put anti skid tiles, so
जी,
the chances of slipperiness is less.
जी.
People put fancy marbles, but with the water, the marble is not a good thing.
Right. So I think we've covered most of the subjects, but Towards the end of the show, Doctor, I would want you to reiterate how to take care of ourselves in the monsoon, especially people who have delicate health or who need to be extra cautious, especially kids and elderly too. Top tips from you, Doctor.
I think one important top tip is monsoon comes once a year. Enjoy your monsoon, but be
Yeah.
sensible. हमें बारिश की बूंदें बहुत अच्छी लगती है, बारिश गिरता हुआ भी अच्छा लगता है, और बारिश के सामने चाय और कॉफी पीना भी अच्छा लगता है. But understand the common conditions that we have discussed that can affect you. Keep suitable precautions as much as you can. In life, you cannot take precautions everything in life, otherwise you will stop living. आप घर से रूम से बाहर भी नहीं निकल पाओगे. But go enjoy, have your sensibility, uh, and make sure that your loved ones are safe and you are safe.
Yes, thank you. So, one quick, there was somebody who was asking about sweat कि वो palms में and ज़्यादा sweat होते हैं monsoons में भी. This is something to be taken care of.
So, can be if there are conditions like thyroid, which increases your sweating levels. There are other hormone conditions which your hormone doctor can look into, which increases your sweatiness. Especially in some people, however, they may have localized sweating only. There are some anti-sweating agents, sprays that are available, जो आपका doctor आपको advise कर सकेगा to reduce the sweatiness of that place. In logic, keep those areas dry as much as you can, because आप अगर उनको ड्राई रखोगे, अगर आप मॉइस्चराइजिंग क्रीम लगा रहे हो तो उस एरिया में ना लगाओ, बिकॉज ऑलरेडी वो वेट है, उसमें आप और मॉइस्चराइजिंग क्रीम लगाओगे तो इट विल बिकम मोर वेट.
Alright. One registered user's question that I would want to ask and then conclude the session, Doctor. Saurabh, 31-year-old male hai. He's facing breathing problems and sweating during long climbs of stairs. So, how can he take care of this?
So that if you are having, see, why do you have a breathing problem? You have a breathing problem because your body is not being able to pump oxygen to the parts of the body that are utilized for you to climb the stairs. It's simple sa logic. Now, what is the problem that happens? Generally, if your heart is affected, your lungs are affected, your hemoglobin is affected, your kidney is affected, your liver is affected. These are the or your sugar is out of control. These are the common conditions that can affect your breathing when you are climbing up the stairs. So please go and see your doctor. This is not monsoon related. Monsoon may generally it is non-specific. It will be seasonal, but you'll have other allergic components. Especially that might suggest कि आपका asthma flare up हो गया. अगर आपको asthma नहीं है and walking up one flight of stairs you are having breathless, you really need to see your doctor on Monday.
Yes, thank you so much, Doctor. So here's my conclusion. I would want you to reiterate the top tips once again. Dr. Mithun Bhartia giving us top tips right now.
Okay, so I think monsoon is very important for our farmers. Monsoon is very important for our country, and monsoon is generally important because it brings the temperature down. It feels a cooling effect on the body. So because it brings a cooling effect, there may be various conditions that can be there. Enjoy your monsoon. Enjoy talking with your loved ones because work is halted, travel is halted. Use this time to communicate with your family, but be safe, understand the conditions that we have discussed, and keep yourself safe and happy for your life.
Wonderful. Thank you. Thank you so much, Dr. Mithun Bhartia, for this Sunday morning and a very informative session at the last
Thank
minute
you.
call. Appreciate
Bye
your time.
bye.
Thank you.
Have a
Namaskar.
nice day.
Thank you. And here comes our quiz session. I know a lot of people have put their concerns regarding their health credits not being credited. We shall take care of it. Also, we request you to check your health credits. They might have been already credited and you've not taken a note of it. So here is how you can participate in the health quiz. I'm going to ask you 3 questions today and you have to answer these questions only on YouTube chat. Winner's name will be announced towards the end of the show. And here's the most important tip, that if I take your name to be the winner, you have to write back to us with all your contact details to marketing@apollo247.com. And winners are strictly selected at the sole discretion of Apollo 24/7 team. And gift vouchers, health credits will be shared with you. आज के 3 questions ये है. First question on the screen. Please fill in the blanks. M से शुरू होता है ये जो वर्ड है, M space L space R I space is the disease that is spread by mosquitoes. Fill in the blank there. Question number 2. True or false? Monsoon infectious diseases are only spread by mosquitoes. Is that true or false? Question number 3. Yes or no में answer कीजिए. Monsoon season causes itching, rashes and redness on the skin. Is that true or false? So these are the 3 questions. Please go ahead and type your answers on YouTube chat only and we shall select a winner. Here are the gift vouchers that you can use on Apollo 24/7. And the first one that we give is ASKDOC 150 Ask Doc, 150 rupees cashback on online doctor consultation. And the next one that we give you is First 3, FIRST3. You get 25% off on online medicine orders. And HH247, that is an exclusive one for our health our viewers. You get 199 off on online doctor consultations with Apollo doctors and also 20% off on medicine orders as well. Apollo 24/7 is now available on WhatsApp. Please do save this number 09355247247 to avail healthcare services. You're just a call away or a text away on WhatsApp as well. Next week, we are going to talk about psychosomatic diseases and how to treat them. जो कहीं दिखता नहीं है, कोई भी आपको टेस्ट में आपको पता नहीं चलता है कि आपका पेन है या डिसीज है, पर आपको वो फील हो रहा है and you actually have all the symptoms. That is called a psychosomatic disease. And how do you treat them? We shall talk everything about it. That's next Sunday, 30th July. 11 a.m. Please join us on Apollo 24/7. And before I take leave for today, I'm going to announce the winners. But also ensure that you subscribe our YouTube channel so that you don't miss these informative sessions. These are very, very informative sessions where experts from Apollo hospitals come join us every Sunday for a live session. This is very, very valuable. Do subscribe and do not miss any of these sessions. So waiting for the winners. I'm seeing what's happening at the winners. Yes, a lot of them are. Congratulations. The winners are Manish Sharma, Renuka Sridhar and Prithvi. These are the winners for this week. Today's Health Hour winners are also put in the description box. Please write back to us with your contact details and claim your prizes. Thank you all of you. We shall see you next week. Namaskar.